We're good.
Okay. The Ledyard Town Council Community Relations Committee meeting dated June 2nd, 2021. This is a public informational meeting. And at this point, I would like to have, bear with me. I was a little late for work, so.
We have Scott Johnson from the Senior Center tonight and Karen Gotch is as the nursing director. I think Scott's up.
Thank you, Roxanne. Scott, would you like to at this time present the senior center community presentation?
Yeah.
Go ahead, Scott.
All right. So we have the senior center. The senior center is all of our services, programs, activities are available for anyone that's 55 years and older. Our hours are open 8:30 to 2:30 Monday through Friday. And we do occasionally do some trips in off hours and different programs in the evenings as well. Sometimes a dinner or hometown heroes, things like that. We have a variety of different programs. Some of them are free, some of them do cost money. Typically our programs run about 10 weeks at a time and they cost about $50 for residents, and then $55 to $60 for non-residents. A few classes are different, like aqua size because it's in a different facility. But we have actually a new program we're starting as a Seniors on the Move, which is a hiking group. We have aqua size, which is actually being held at the VAT, the new pool in town. We have a number of different yoga classes, from just regular yoga, mat yoga, chair yoga, and probably a long list of others. Yoga's very popular. We have a Latin line dancing class, Tai Chi. We partner with the library. We do a book discussion group. We have a number of different card games that pretty much anytime you walk into the senior center, there's some sort of card game going on in one room. Whether it's the big room in the library, anything from pitch, bridge, pinochle, we'll have mahjong. It's Monday through Friday, there's different card games. And then in the big room, people will come in and just play various games throughout the day that aren't even organized. They'll just come in and play bridge and at a table. But we do have groups that'll meet on, like Friday is, I believe, pinochle, mahjong, I think it's on Thursdays. We're working right now to get all those put back together as the senior center is opening back up tomorrow. We have a strong fit at any age fitness class, which actually replaced the silver sneakers. The only difference is silver sneakers was dependent on what insurance provider you had, whether or not you could take it or pay. So she's gone a different route. With this new class, you won't have to, worry about Medicare, Medicaid. Would just be offered like any other class. We brought in some more arts. We've got a landscape painting class. There's a knitting group. They call themselves the Knitwits. And so they make, quilts, different, hats, gloves, different things like that throughout the year. We do bingo. We have a chorus. We're actually currently looking for a piano player though to be able to start back up. And they will go and perform in different locations, nursing homes, at some of the senior center functions. There's a quilting class. We have a Wii and they do Wii bowling in the mornings, I believe 2 days a week. They'll go in there and bowl. Actually, they do real bowling as well. Don't quote me on it. I believe it's Tuesday afternoons. They actually meet at Spare Time in Groton, and a group of seniors will meet there and actually do real bowling. Dominoes, and then a number of different special events that we offer throughout the year. In classes, they run typically about 10 to 20 people in a class, sometimes less, sometimes more. It really depends on the class and the popularity. Some of the classes they request to keep the smaller groups, things like painting, because there's only a limited number of easels and supplies that they can use. And then for the individualized attention as well, it's hard to give it to a larger group. They go on a number of different trips to see shows, plays, different museums. They'll go out just to lunch at Cracker Barrel, or I believe they were even going pre-pandemic down to the car show at Ocean Beach on, I believe it was Monday nights. They've gone, we also do larger trips, not necessarily all in the senior van, but sometimes we'll do charter trips to like the Boston Flower Show. We've even teamed up with the Groton Senior Center to collaborate on trips, because between, individually we might not be able to fill an entire charter bus ourselves, but we could team up with Groton, and between the two senior centers, we can actually fill a bus and actually be able to go on the trip, because sometimes those larger trips, they have a minimum requirement that they need in order to, provide the charter bus for us. And boat tours, the Lighthouse tour was a very popular trip. And then really we're open to any ideas the seniors, bring to us, whether it's a play, show, just a tourist attraction. Always looking for new trips to go out, get the seniors out and about and active, whether it's on our van or using a charter bus. So then we have a number of different transportation services available. We have 2 senior vans. We're actually getting a new one. I just ordered it this week. I believe it takes up to 6 months for us to receive it. And with our 2 vans, we also have a SUV and a car. We do medical rides on Monday, Tuesdays, Thursdays. We bring people to and from the center for activities or just to hang out and socialize, eat, breakfast or lunch. We do bank runs typically once a month, shopping every Friday. They had the option to go to either Stop and Shop or Walmart. And then also, I believe once a month, we'll do Ocean State job lot trip as well, which is the same day as the bank runs. We're not doing it currently. We need to get another driver, and then once we get another driver, we can return to our full transportation schedule. Currently, it's just a little too much with the medical rides, which are a little more important than going to Ocean State. And we also bring the seniors to vote on election day as well. If a senior needs a ride outside of our transportation hours, which is 8:30 to 2:30, we complete a grant with the surrounding towns, so East Lyme, Waterford, Groton, New London, to participate in what's called the ECTC, and there's a dial-a-ride program. I actually just received word today that this year will also be free. Last year was free. The previous year was $20. There's more rides this year. I think last year was like 20, and this year was 26 one-way rides. Today I found out they're going to get 36 one-way rides for no fee, as long as there's money left in the grant. And then there's also programs, outside of that. So there's a caregiver mileage reimbursement program. So if a senior needs rides and has a neighbor or family member that's able to, give them transportation, that person can then be reimbursed through this reimbursement program. And then if somebody is to use all 36 of their one-way rides, they can actually buy through the ECTC voucher program, which allows them to use taxi and livery services in the area. And it's basically, I think, half off what the taxi would typically cost. So if you spend $5 on the voucher, I think it's worth $10 towards the ride. So it helps, keep the cost down for seniors if they need to get to medical appointments or, anywhere outside of our operating hours of 8:30 to 2:30 for medicals, Monday, Tuesdays, and Thursdays. We offer breakfast and lunch. So we do have cafe meals that are made to order. And actually, they were more popular than the TVCCA meals that they did in-house. So we actually don't offer the TVCCA in-house meals. We only do the meals that go out and are delivered, because nobody was ordering them when you can get a full cooked, meal to order for $2-3. They weren't buying the Meals on Wheels meal, which was much smaller and actually might even been more expensive. So he does breakfast and lunch every day, except for typically on Wednesdays, because we're currently doing a takeout meal during the pandemic. And actually, since we started in October, we've served over 800 meals just on Wednesdays alone for our pickup meals. And pre-pandemic, we would have Wednesday community meals and have anywhere between 30 to 50 people each week, depending on the lunch menu for the day. And it would be cooked by various community groups. And then all the proceeds would go to that organization. And it's typically $6 for the full meal, and you're getting like 3 courses, a salad, the meal with sides, and typically a dessert. Then we also do holiday lunches as well. Tomorrow we're doing kind of a Memorial Day / reopening celebration, and we have, I think, just under 70 people registered to come have our cookout tomorrow. So we're very excited about that. Get people back in the door and into the center again. Show them what we have to offer with various classes that we're going to demonstrate. We have a number of other services. So we have TVCCA Meals on Wheels, which is a fantastic program. It's more than just a hot meal that gets delivered daily. It's also socialization and a wellness check. The individuals on this program are homebound seniors, so they're not able to really get out, go shopping unless we bring them. So it's great that they get a hot meal, so we know that they're eating, but also it allows somebody to check in on them every day, and then just have a nice little conversation with them, and it means a lot to them, especially when they're isolated. We have a hair salon that operates Tuesdays and Thursdays, and seniors can call Amy directly to set up an appointment. We have the podiatrist comes once every 2 to 3 months, and he takes insurance. I think if you don't have insurance, you can pay a small fee to still have your feet looked at. We also do the AARP driver safety program. It's currently on hold for in-person classes, but this is a very popular program because if a senior takes this driver safety program, I believe it's good for 2 years. They actually get a discount on their insurance. And then Karen will come in, monthly, every 2 or 3 months. We'll do blood pressure clinics. We do flu shot clinics. We've teamed up with Ledyard, and we've done prescription take back days with Ledyard as well as the police. We usually do 1 or 2 per year because the seniors tend to have a lot of excess medications in their medicine cabinet, and we don't want that getting into the wrong hands if they have grandchildren. And then Karen can probably talk a little more on the renters rebate program. She kind of handles that. I feel like I might have missed something, but I don't know if anybody has any questions.
Scott, excuse me, could you kind of expound on the cost relative to the services that are being provided?
Oh, okay, yeah, that's what I think I was forgetting something. So for our van, for transportation services, technically we won't turn anybody away if they can't afford to go on a ride. We do ask a $1 suggested donation in town and a $2 suggested donation out of town, but we won't turn anybody away due to cost, because that's part of the grant. We get grants to provide those services to pay for those vehicles. We do ask for just a suggested donation. The salon, I don't have all of it. It depends kind of on what you're getting. She has a full service menu. It's very affordable compared to going out to an actual beauty salon. I want to say like a haircut's $20 or less. But she does everything from haircuts to dry and set, the perms, the wash, all kinds of services, hair dyeing. She offers it all right on site, which is nice because some of the seniors will actually ride the bus to the center to be able to get their hair cut. Let's see what else here. The podiatrist, he takes insurance, so the price would it depends on if you have insurance or not. Typically, insurance will cover it because I think most seniors have the Medicare or Medicaid. I think if they don't, they can still get the service provided, and then they just assess the fee. The AARP Safe Driving Program, I'm not sure the cost. It might even be free, or there might be a small cost because they do get a book. But that's all through AARP, and they actually come in and teach the class. We just sign up, and then when they come that day, they pay them directly. It kind of takes us out of the equation. A lot of the other stuff is free. So, the clinics like blood pressure, flu, we do that all for free. And the lunches are typically, if it's a holiday lunch or our Wednesday lunch, it's either $6 or $7. Then our cafe meals are very affordable. Most of the items tend to be about $2, maybe $3 for some of the bigger meals. So, keep the cost down for the seniors. The main thing is they're fed.
Nope, that's it. And at this point, V&A, any questions for Scott, please? Looking through, I don't see any questions for him.
Hey, Mike, I just wanted to say thank you to Scott.
Thank you, Scott.
Oh, definitely.
Great job.
Thank you, Scott, for
Thanks for
the
having me.
presentation.
Okay, so Ledyard V&A is, a town-funded Medicare certified agency, meaning your tax dollars pay for our services. The couple of the signs that you see there are awards that we've won for being the top in the country as far as quality and patient satisfaction. And I'll talk a little bit about that later, but it is really for Little Ledyard, Connecticut, we are one of the top 12,000 agencies in the country, which is really, we work hard, but it's really amazing. So you have a great agency at your disposal to call on if you need home care. So what do we do? Let's see. We really do a lot, but we have under home care, which your insurance covers. You do not have to pay anything unless your insurance has a copay, and that depends on what you had picked out. But we have skilled nursing, physical therapy, occupational. We have aides that come in and can give you a shower and help you dress, social worker to help you sort out finances or maybe placement if it's time to look into other, you can't live at home anymore, speech therapy. And then equipment, we do have an equipment room with things that you may not have at home that you can have for free. You can have them as long as you need them, as far as there might be a shower chair or a commode, walkers, or therapy people. They come in and they take out things for residents as they need them. And it really, so you don't have to incur a cost. So how did we do last year? We do pretty good. We had over 5,000, close to 6,000 visits, which is considering, and that's all the services together. So considering Ledyard small, it keeps us busy, the amount of staff we have. So we really enjoy coming into your home. We enjoy helping you get better and setting your goals for what you want to achieve. Everybody's are different. They're all individuals. So we will work with you and our staff to get you to the next level. And then our revenue, if you're interested in how much money we make, this is all goes back to the town, to the general fund. Medicare, we average about 700. If we have more residents, we can go up to $1 million in revenue. Medicaid doesn't pay as well, and we don't have as many patients, although the past year, because of pandemic, we saw more people on Medicaid. And that is a state-funded program. We have all the managed cares like United Healthcare, Connecticut, the ones that people, there's so many offshoots now that Blue Cross, so the private pay. So we also have people who, when they don't qualify for home care anymore and they still need a shower, they will pay $25 an hour, which is usually once or twice a week, for an aide to come in and help shower them. And I have to say, I think it's life-saving for a lot of people to help the families out. And compared to private agencies, I mean, it's a great deal. We offer, let's see, we have office visits, we have CPR classes, and the CARES Act, we did, Ledyard did receive money for COVID last year. It depended on how much money we brought in the year before from Medicare. They took, I don't know how they figured it out. So we got about 44,000 in COVID money to supplement the lack of residents that were asking for care because of the pandemic and also because of PPE that we had to get. But the good thing is that the National Guard, every week at Mohegan Sun, I would show up on Thursdays and they would open the doors and they would fill the car up. And they, you know, they'd give you gowns and masks. I even got some soap one time. So, I mean, they were great, the National Guard. I mean, they really did a great job. So we do have a lot of PPE in case we need it again. And flu shots, we don't do as many because everybody gets them everywhere, but we will have every fall the flu shots. And this year we are going to carry the over 65 flu vaccine. There's two, there's one a little bit stronger for over 65, and it's more expensive, but we did order it already. So we will have that for over 65, which is great. So that's the revenue we brought in last year, which covers our budget, which covers the cost of nursing. So how do you get us? You can call us, you can email me. You can usually, it's your doctor that might call and say somebody's having a problem in the community. Can you go in and see them? Hospitals call us, or now they're on computers, so they email us. Family, friends, the patient themselves, if they're going in for a hip or knee, they call us a lot of times and ask us to see them when they get out, which we do. So we start the paperwork. So as I said, phone me, email me. Epic is the computer system for Yale and Hartford Healthcare. And as I said, in Village Market, we get referrals. People who are worried about somebody or somebody's upcoming surgery. So we are your community agency. So that's how we hear about referrals a lot of the time. So as I said, home care we focus on a lot because that's the one that is reimbursed. We're very regulated by the state and federal because we take money, but our job is to keep you home. School nursing falls under our department also with the 5 schools with RNs and the aides. We have the Ledyard Emergency Service Clinics, which are the firemen, which we do every other month at the high school. Dr. Gates is our medical director. He comes in, and that's free to the town to do that. And as Scott says, I do the blood pressure clinics. And then the renter's rebate, if you qualify as far as making a certain amount of money every year, if you single 35,000, couple under 45,000, you submit the right paperwork and we can get you some money in October. If you have any questions, just give me a call. I can explain it. As I said, we do have Johnson & Johnson COVID vaccine. We have the flu every fall. Potassium iodine we have. And then I'm also in charge of the special needs list in case of emergencies in town. And if we had to evacuate because of millstone, I also do that. And let's see. And then as I stated in the beginning, they rate us, the government rates us out of 5 stars, and we typically are 4, sometimes we're 5. So we're one of the highest, as I said, rated agencies. So, so the goal is to get people to utilize us as much as possible. And if you've had another agency and you've had us, you know the difference. So it's a great asset to the town. That's all I have.
This is a quick question. This is Mike Washington, Councilor Washington. Sure. Relative to cost, and just so I have a full understanding of the grouping. So this is Medicaid or Medicare?
Both. We take Medicare, which is the federal insurance over 65, and Medicaid is the state that if you are disabled, you need assistance, you need insurance, you qualify for Medicaid, we take that also.
So just playing the devil's advocate, if I'm in the hospital for something and I'm going to need home health care, I need to actually ask for the Ledyard VNA.
Correct. So that is the big, over the past years, that's what's happened because it's so competitive. Because of the other agency, the hospitals, Yale and Hartford Healthcare have their own agencies. They will throw the business, if you want to call it business, they throw the business to their agencies to get the insurance money. So you definitely have to ask for Ledyard VNA or call me and I can, set it up beforehand. But that's what the residents have to know to get the top rated agency that they have to ask.
Okay.
Good question.
Yep. Just from personal experience, my father had Ledyard VNA back in the day, and it was excellent.
Oh.
And the patience was I can't say enough about the patience of the people who came out from my father because he was very difficult.
No, I'm
so
sure
thank you. Thank you.
No, it's as I said, we love what we do and we're really good at what we do. So you do want us to walk into your house and help you. So, and so Ledyard's lucky.
We do very well. Does anybody have any questions?
I do, Mr. Chair. Karen,
Go ahead, Councilor Soms.
can you, or have you considered, can you speak to the shingles vaccine?
The shingles vaccine, we do not carry it. It is available at the pharmacies, and I do recommend it for people over 60 to go. It's a 2-shot, 3 months apart, but I have to get my second one. It was on hold because I got COVID vaccines in between, but I do have to get there and get it. But you do not want shingles.
No.
It's a tough disease. The virus, chickenpox virus, and it is, has a lot of complications. And so if you haven't gotten it, CVS, you walk right in, they give it to you. So.
I was thinking more for seniors who aren't as mobile and may not even be aware that they need it. Is there anything that you could be involved with to get them a shingles vaccine?
Sure, we can, you know, I can work with Scott at the senior center and get something out in the next, you know, in the newsletter. The event magazine, I can put it in there. And so definitely, because hopefully their primary care physician has told them about it, but if
Mhm.
not, you know, we can fill in the gaps.
Yeah,
But that's a good question.
Okay.
Sorry, the
Right.
clock is,
And we consider vaccines like a medical appointment. So we do take senior, like, so if they needed a COVID vaccine, they can
Yeah.
use transportation for that. So if they needed to go to CVS for,
Yeah.
you know, that.
and give it to them. So they just,
Right.
but again, it's the awareness factor. Do they know? But, you know, I will add that on my list, especially when we start doing the flu again, to make sure that they've, you know, have had their shingle vaccine.
when do you start the flu shots?
Well, we, as I said, we just ordered it, so it should start, I mean, probably sooner than later. I would think September.
Yeah, okay.
And then start as, you know, I think CVS starts advertising like next month.
Wow.
You know,
Wow.
they just, but the efficacy is just 9 months on the flu vaccine.
Oh,
So, you know, and then our second wave, when we do have a typical flu season, usually hits in April. So if you get it towards September, the end of September, beginning of October, that covers you to the spring for coverage.
So someone would, just so I understand this, so given the time frame, someone should expect to take another shot in the spring?
No, your shot you take in the fall. If you take it in September, October, November, December, January, February, March, April, May, June. So your shot in the fall will carry you to the spring.
Okay, thank you.
That's why we give it yearly, because it's, and then they do the viruses from the following year. So that's why we do a whole new flu vaccine.
we
Understood.
have a chat question here, Mike. What if you already had shingles? Should you get the shingles vaccine?
I would think yes, because I think the virus is still in your system, but that's, but I'll research that for you. But I, you know, like the COVID vaccine,
Yeah.
who had COVID are still urged to get the vaccine. But I will, that's a good question. I'll find out.
Okay, thank you.
Does anybody have any other questions, please? Bear with me for a second.
Not really a question, but I think it might be helpful if when the video of this is ready, that we throw it on the Ledyard resource page, just with like maybe 3 to 5 bullet points from Scott and Karen's presentations to get it out there. Kind of like a, hey, did you know, and the highlights. Because I think they both shared some really key information that our residents would be interested in hearing.
Yeah.
But they're probably all over at the market tonight, you know.
I
A lot
understand.
of food.
I concur.
I was sitting here texting people about some of the programs as you were both talking, saying, hey, did you know?
Yeah.
Yeah, they, you know, we, like Scott, we try to get the word out, and,
Yeah.
you know, we talk to everybody, we, you know, every possible way. So, but we can only do so much.
Yeah.
Understood.
Good idea, Andre.
Are there any further
Roxanne, I
questions?
saw your message that the video will be ready in the morning.
That'll be on iCompass. I don't know about the resource page, so.
Okay.
Yeah, so one of us can just, well, what do we do? Copy the link, I guess.
I can post a link.
Yeah.
I'll send you the link.
Thank you, Roxanne. Are there any further questions for anybody? That being the case, bear with me. Do we have any, I'll ask one more time, is there any questions relative to the senior center programs or the visiting nurse program?
I'm good.
I'm
Thank you both.
good.
With that
Thank you,
being
Scott.
said,
Thank you, Karen.
yes, thank you so much for providing this information. And hopefully people will take the opportunity to also replay this since it's been recorded. And it's a great value to the town. And it's amazing how many people may or may not know that it exists. And hopefully through knowledge and that people will be able to maximize the use of the facilities and the resources available through the town.
Mhm.
With that, I'm going to call this public informational meeting closed.
All righty.
Thank you, Mr. Chair.
Thank you, everybody, for
Bye, everybody.
participating. Greatly appreciated, and have a great night. Thank you.
You too.